7, 6, 5, 4, 3, 2, 1.
You'll never have the sacred stone.
Oh, this you crazy mother.
Hey loves, so welcome back to Bama Girls Cafe and Honey. Today we're going to be talking about my breast reduction, my doctor, the experience, how I felt about it, and everything. I'm going to give y'all the whole rundown, the tea, and I'm also going to give you guys about the doctor who slayed these boobies, honey. Okay, so back in 2015, I decided that I needed to get a breast reduction because, y'all, I was in a lot of pain. But I could not find a surgeon in Kansas that I trusted. The healthcare out in Kansas was not good for people who look like me. I'm just going to say that. I got misdiagnosed with 3 things. Misdiagnosed 3 times with 3 different occasions. So I knew I was not going to let nobody do no kind of surgery on me out there. So we got back to Alabama. I started entertaining the idea of getting a breast reduction. Then I went to my doctor. I got approved. They sent the letter to the insurance company. The insurance company approved me. And I kind of just stuck the little paper in my drawer and kind of forgot about it. Well, honey, around February, my back was hurting. I could not sleep. I was just in a lot of pain. I was beyond uncomfortable. So I said, you know what? I'm going to pull this paper out and I'm going to go ahead and go through with the breast reduction. So I called my insurance company. They gave me a list of doctors that I could, you know, reach out to in the local area or out of my radius, as long as they were in the area in so many radiuses or whatever. And they accepted TRICARE, then I was fine. So one of the doctors on the list was Dr. Martin, Dr. Justin Martin of Dotson Plastic Surgery. I found him also on Real Self. And I'm going to tell y'all, he got, like, his reviews on any website that I pulled him up on were just phenomenal. So I said, okay, I'm going to make an appointment. Another month passed by, and then I was like, okay, I'm going to go ahead and make the appointment. So I made the appointment. I did my first consultation. Y'all, when I walked into his office, it was just so peaceful. They had some aromatherapy. They had a fountain. The receptionist was really nice. She was soft-spoken. She knew who I was. They talked to me. They showed me some pamphlets. And I sat there and I waited. And I wasn't even in there 5 minutes. And I was already getting calls to the back and talking to the nurse. She told me to go ahead and put on a robe. They gave me a nice little plush cushy robe. And the nurse was really friendly. She talked to me. She asked me my name. She took some pictures. And then Dr. Martin came in. Well, y'all, let me tell y'all, he's quite handsome. He's a young guy. He's a young doctor. He's very handsome. He's very soft-spoken. He's very kind. I'm going to place a picture of him right here. And it just made me feel real comfortable. I talked to him about my concerns, what I wanted to do. And right then and there, he was like, okay, so do you have a date where you want to do the surgery? I was like, oh, that quick? He was like, yeah. So I was like, well, first I want to lose a couple pounds and kind of get my body ready for surgery. And he was like, okay, cool. So I went home. I talked to my husband. I called back and I was like, okay, so what about May 30th? And they were like, sure. So I was like, okay, when that time rolled around, I've been went on my vacation. I've been got some things taken care of. I've been took some time off from YouTube. So boom. So 2 weeks before surgery, I went in for my second pre-op appointment. He did my measurements again. I expressed to him how important it would be for him to be able to do the surgery that would allow me to possibly be able to breastfeed after having a breast reduction. He told me because of my measurements, it may not be possible, that I would be probably at a higher risk of losing my nipple. So that really freaked me out. But he did tell me that we could look at it, explore options. So I told him, you know, I would pray about it. We talked about it a little bit more. He reassured me about everything. He talked to me. He spent a lot of time with me. And I just felt like I wasn't just another patient with a checkbook or just somebody who was going, they was going to make some coins off of. They treated me like a person and not a patient. And there's a difference. So I left the office. They filed the medical claim. Everything was taken care of. They filed with my insurance. I didn't have to do anything with my insurance. They took care of everything with insurance. All I had to do that morning was sign up a surgery, sign into the hospital, and then that was it. Like, they basically took care of everything. 2 days before surgery, a day before surgery, I went over, I picked up my prescriptions, I got them filled, I got them home, I got bandages and things that I would need. They sent me home with a lot of stuff, so I really didn't even have to buy much. The morning of surgery, I was real nervous, so he discussed the options with me again. He just told me, okay, we will see what happens when we get into surgery. If your nipples look like they're going to survive, then I'll do it that way and we won't graft them out. If they don't, then we're going to just do the graft. I said, okay, I trust you. Do what you do, because, you know, I feel real comfortable with him. And I know that he had I knew that he would do everything to get me the best results possible, so I ain't sweated. So, long story short, did the surgery. The following week, I went back over. He took, you know, he looked at me. Everything was fine. I have like one little scar up under my boob, and I think it was from one of the bras rubbing after surgery, but it's scabbed over and healed up just fine. Other than that, I had no problems with my surgery. After 3 days, I was off of the perks. I don't like Percocet because it made me feel real funny. And then that was pretty much it. And I just been kind of like chilling, not doing too much, kind of hanging around the house, not picking up anything over 5 pounds. It's just been real easy breezy, seasy. So what can I tell y'all about Dr. Martin? Because this is really what this is about. This video is definitely not about me, but I'm going to show y'all these new boobies. Ooh, let me get up so y'all can see them. Shimmy, shimmy, shimmy. Shimmy, shimmy, shimmy. So yeah, these are the new boobs. Turn to the side. Ow. Look at that. Look at that, yeah. So, let me tell y'all about Dr. Martin. Dr. Martin is a local and a native of Dalton, Alabama. He works at Dalton's Plastic Surgery, 105 Professional Lane, Dalton, Alabama. Let's talk about his certifications. He is board certified by the American Board of Plastic Surgery. He works out of Flowers Hospital, where I had my surgery. And he also works out of Medical Center Enterprise in Alabama. His undergrad and medical school. He went to undergrad at I can't never pronounce this right. I just practiced saying this. Woo, okay. Y'all forgive me. Dr. Martin, I'm so sorry. It's a school in Nashville, Tennessee. Vanderbilt. I cannot pronounce it. I'm gonna come back to it. He went to school there. He went to the University of Alabama School of Medicine in 2000 and 2007. Excuse me, 2013 he went to Vanderbilt. I'm gonna leave it right here. School for his, I guess, for his undergrad. His post medical school training in general surgery was with the University of Birmingham. At the University of Birmingham in 2018. His residency, general surgery, University of Alabama at Birmingham. His fellowship, plastic surgery, the University of Virginia Healthcare System 2000. Vanderbilt. I think that's how you pronounce the college. His first college in 2003. So basically, y'all, me and Dr. Martin graduated the same year, 2000. No, I graduated high school 2003. Sorry, it's Vanderbilt. I can't pronounce it. I'll come back to it. Okay, so So his internship was at the University Health System of Virginia in plastic surgery, which is a really good school, y'all. So he had all the criteria that needed. Vanderbilt. That's the name how you pronounce it. Vanderbilt. Vanderbilt University. That's how you pronounce it. Sorry, Dr. Martin. Some things that he does: arm lifts, birthmark removals, breast reductions, breast augmentation, implants, breast lift with implants, breast reduction, revisions, breast reductions, and something else. But he does breast reductions, brow lift, earlobe, ear surgery, eye bag, treat therapy, eyelid surgery, facelift, fat transfers, forehead lifts, and you know where they fix your lady parts if they look a little raggedy, he does that too. But he does mommy makeover, neck lift, nipple surgery, all kind. If you can think about it, he do it, okay? And I'm just gonna say, if you are a woman in the area, or you are 2 or 3 hours away, even 4 or 5, honey, I would definitely say come on down to Dothan and check him out, because I just felt so comfortable the day of surgery. After I came to my right mind, his bedside manners were just really good, real charismatic. He made me kind of chuckle a little bit. But just seeing him walk into the room really lifted my spirits. The next morning he came in. I didn't go home with drains. He came in, he took my drains out. He was really gentle. Most people say when they get their drains out, the doctors hurt them or whatever. I didn't have any problems. He took my drains out. He was very gentle. He talked to me. He gave me my post-op care. One of the nurses who was in the room that morning had actually had her breast done by him. Them things look good, girl. Hey! But I met a couple of people at the hospital that he had actually done surgery on. So anytime you're working in a medical profession and people like come to you, that means you use the shiznit. So I met a couple of people that he had did surgery on, and they looked fabulous, and they really seemed like it boosted their self-esteem. So I know that my titties was gonna look good. But I really enjoyed the surgery. I go in tomorrow for my last, I think I have one more after this, but just this is it for my 6th week. I have stitching this boob that I'm going to be getting out tomorrow. And that's pretty much the end of my plastic surgery journey. As you guys know, I've been working on trying to lose weight. I've been waist training, doing fit tea, apple cider vinegar, walking, doing light workout because I can't do anything. I can start running tomorrow. And that's pretty much it. That's all I've been doing, just kind of like finessing it. But yeah, I just want to say to Dr. Martin and all the people over at Martin Surgery Center, thank you guys, because y'all really made me feel special. I have some people that are going to be coming your way. Dr. Martin, you are phenomenal. I would never let anybody else touch my body for any kind of surgery. So after I had these kids, I'm coming to see you for a mommy makeover. But yeah, I really enjoyed it. The Dr. Justin Martin is like the best kind of surgeon you would ever want. I feel like if he couldn't do something, or if he didn't feel like it was something that he would do, I feel like he's the type of doctor who would be honest with you and would send you to somebody else who could get you where he wants you, where you need to be. And then they also have another surgeon who's in the office too that I hear is fabulous. So I feel like he's had all the right training. He has good bedside manner. The ladies who worked in the office were very nice. They were very sweet. So I just feel like I would definitely go back. I feel like we got our money's worth. Hello, insurance. And it was just overall a good experience. I have no horror stories to tell you guys about my plastic surgery. Except for the first couple of days were kind of rough. But I was up and walking. Shout out to Flowers Hospital. I can't remember the nurse I had on the night shift or the morning shift, but they really took good care of me. My nurse on the night shift, y'all, she was gorgeous. She had red hair. Her makeup was big. I was like, well, her face was fabulous. And the nurse I had that morning was really nice and sweet, and she had actually had her boobs done by Dr. Martin too. So I felt like we were boobie sisters. But everything was really nice. The hospital was clean. They took really good care of me. Like I said, he came and checked on me twice during my stay. It was just an overall good experience. Now, I don't know what size bra I wear yet because I've been wearing sports bras and wireless bras, because you're not supposed to wear anything like that until the doctor tells you to. So as soon as I know what to do, a bikini haul, and I'm going to do a underwear type video. So you guys be on the lookout for that sometime next month. But as far as I'm concerned, you guys, I just love my breasts. I feel like they complement my body. I feel super sexy. He didn't chop me up. He didn't butcher me. He gave me enough to love. I got some nice cleavage. Ooh. But yeah, that's pretty much it. Thank you guys for tuning in for this video. Dr. Martin, all the ladies in the office, I love y'all, and I hope you guys enjoyed my review.